Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below. Hello everyone, welcome. This is Dr. Jacobs. In this video, I'm gonna talk about how to stop hand pain or relieve hand pain. But before I do that, we're gonna go over common causes and risk factors for hand pain, the symptoms of hand pain, and then we'll go over the treatment that you can do at home to relieve your hand pain. So what are some of the symptoms of hand pain? So sometimes if you have carpal tunnel, you might experience some numbness, tingling in your fingers from the front and the back. Also, you will feel like some weaknesses in your hand when you grab onto something, when you hold a pen or cup. Muscle weaknesses, numbness, tingling, and stiffness in the joint and not able to bend smoothly, bend your fingers smoothly. So the causes of hand pain, it could be from arthritis, could be from osteoarthritis, and I have videos on each of these causes. You can check it out in my YouTube channel. One of the causes could be a trigger finger, so I have a video on that. That's inflammation and scarring on this area that caused your finger not straightening. Check it out in my YouTube channel. Also, and the other cause could be a carpal tunnel syndrome, which is inflammation and scarring deep in the carpal tunnel here that actually cause radiated pain in the hand. The other cause could be decurvain tensivitis, which is inflammation in the tendon here, and I have another video on it. And the other common thing is arthritis, and you can see it here in this image actually. That swelling in the joint, that's arthritic changes, and that could cause stiffness, hand pain, weaknesses. Galgonian cyst, and you see it here in this image. It's a swelling of the cyst here in that area. It could be in other different areas. So these are the causes for hand pain. And you can see the trigger finger, you can see it here. It's a swelling, inflammation, and scarring here in this area that cause the finger to stuck when you try to straighten up. That's a trigger finger. So what are the risk factors for hand pain? Well, one of the risk factors, you might be diabetic or you have rheumatoid arthritis, hormonal imbalance during pregnancy or the menopause. If you have thyroid issue, that will slow down your normal healing cycle. If you do a lot of repetitive activity that cause injury to your hand, that could be a risk factors. The other risk factors could be obesity and hereditary. So how to treat the root cause of the hand pain? In order to do that, we need to understand normal healing cycle, because we don't want to focus on just it's a trigger finger or carpal tunnel or whatever condition was labeled for your hand pain. If we understand the normal healing cycle, it make a lot of sense how to get to the root cause of the problem. So your body has to go through 3 stages in order to heal. I'm gonna use external paper cut for visualization, but the same process happened internally. From accident, trauma, from carpal tunnel, trigger finger, arthritis, your body has to go through those 3 stages in order to heal. But you don't see it because the skin covers it. So the first stage of healing is the inflammation. You can see in the first image swelling, redness, the blood starts to rush to that area, and you start to experience pain. And you can see in those conditions with the arthritis, you can see that swelling in the joint, and in the carpal tunnel, you can see it in here, swelling and inflammation in this area. And also in the trigger finger, you will have the swelling and the inflammation in this area. Second stage of healing is the proliferation stage. That's when your body starts to build a scar tissue. During this stage, there is a cascade of events: scar tissue, fascia restrictions, muscle spasm, trigger points. Just gonna go over the scar tissue for the sake of our time now, but I will cover the fascia restrictions a little bit later. So perfect scenario, actually during the maturation stage, your body should get rid of everything and clears up. that could take days, weeks, months, or years. The problem, if your body have excessive scar tissue, our muscle should act like a rubber band. When you contract and relax, should stretch like this. So when you have a scar tissue, it's like you have a knot in a rubber band. When your muscle contracts, it does not really stretch much, and that could compress on nerve and artery. That's what happened with the carpal tunnel, compress on the median nerve and cause radiculopathy or the nerve pain. Or if it's happened in this area of your fingers, you start to expand trigger finger, or arthritis, you start to have a lot of scarring and swelling and cause the joint stiffness. So if you have a chronic condition, your body probably going back and forth between inflammation and proliferation. In order to treat the root cause of the problem, we really need to attack this issue from both ends, inflammation and proliferation stage. Briefly, I will go over some of the common treatment that been used for hand pain, but it doesn't work very well based on the studies. And then we're gonna relate that to the normal healing cycle, and at the end, I will go over how to get to the root cause of the hand pain. One of the things that commonly use heat, steam, or ice to decrease inflammation, temporarily decrease pain, but when we look at the normal healing cycle, that does not do much to the inflammation or the proliferation stage. The other thing that's been used is foam roller and massage, and the problem of that is if you have inflamed area and swelling and you rub over it, you might make it more inflamed. The other thing is, based on the studies, foam roller and massage either provide temporary pain relief or no pain relief, but does not provide long-term pain relief. When I go over the fascia system and the scar tissue, it will make a lot of sense why foam roller and massage are not effective, because it's mechanically impossible to do deep release with those modality. The other thing that commonly used is stretching. The problem with the stretching is if you overstretch, if you have a micro tear in the muscle, you're gonna tear it more. And the other thing is, based on the studies, stretching causes more inflammation. So if you have inflamed area, it's gonna make it inflamed more. I personally do not recommend the stretching because it could cause more aggravation of the symptoms, and there is other alternative safe option that can be used than stretching that's more effective. The other thing that's been used by healthcare providers like chiropractor, occupational therapists, physical therapists, is joint mobilization. But when we look at the normal healing cycle, you have inflammation, you have scar tissue, fascia restriction. When you move the joint, that's not going to make a lot of effect to the problem. And based on the studies, joint mobilization either provide short-term pain reduction or no pain reduction. So lastly is the strength exercises. We want to do strength exercises, we want to do exercises, but if you do it during the inflammation stage, you're gonna make it inflame more. So we want to introduce the strength exercises, but we want to introduce it in the right time. So how to get to the root cause of hand pain? Well, we have to break this vicious cycle from both ends, the inflammation stage and the proliferation stage. So what I personally do for the inflammation stage, initially, if you have a mild inflammation, rest. Avoid the repetitive motion that's aggravated. If you have moderate to severe inflammation, you're probably going back and forth between inflammation and proliferation here. So we have to be aggressive on breaking this vicious cycle. So for the inflammation, what I personally use, I use a pain relief cream, and that also has anti-inflammatory ingredients to decrease the inflammation, and I use a Magna Heal 2 on the inflamed area. If it's mild, moderate inflammation, that should take a few sessions to get the inflammation under control. The other thing what I like to do is to put all my patient on anti-inflammatory diet, because there is a lot of food that could cause internal inflammation and slow down the healing cycle. So I will make sure that all the patient on that diet, so when we use the Magna Heal and the cream, the inflammation will decrease quickly. If you have severe vitamins mineral deficiency, your inflammation will be very severe. And for those patients, I usually recommend to do a comprehensive evaluation to figure out what kind of vitamins and mineral deficiency you might have. One of the easiest way you can do is go to askastr.com. It's a free online medical evaluation. The software will help you to figure out what possible vitamins and mineral deficiency you might have, and it takes about 5 minutes. At the same time, we have to work on a proliferation stage: the scar tissue, the fascia restriction, the muscle spasm, and the trigger point. What I personally use is the A3 to break the superficial scar tissue, and I use the A5 to release and break deep scar tissue, fascia restriction, muscle spasm. And that's why I said the massage or foam roller will not gonna work very well, because it's impossible with the hand or the foam roller to go deep enough to cause mechanical force to break the adhesion. That's why I use the A5. The other thing we have to work on simultaneously is to release fascia restrictions. Briefly, I will go over the fascia system because it has significant effect on hand pain, and it's overlooked by a lot of healthcare providers. To make things complicated, but don't worry, the treatment is extremely simple. The system consists of several layers. So the superficial fascia layer wrapping the entire body, and then we have the deep layer that wrapping a group of muscles and individual muscle and individual fiber. And when you have fascia restriction, it's like you wearing a t-shirt 2 to 3 size too small. You can see the fascia system or the fascia layers here in this image. The first layer is the superficial layer, and you can see the white filament here. That's the fascia system. And when you buy meat next time, I want you to look and see the filaments that's in the meat, and that is actually the fascia system. So when you have fascia restriction, some or most of these layers actually get restricted. To make things more complicated, the system consists of 2 main categories: superficial layer and deep layer. And each of those categories has 2 to 3 layers on the top of each other. And the deep layer is actually divided to 4 subcategories. So the deep layer divided to apparatic fascia, epimysin, premiysin, and endomysin, and each of these has 2 to 3 layers underneath them. So you can see here the epimysin wrapping each individual muscle fiber, and then the premiysin wrapping a group of muscle fibers, bundles in here. And then at the end we have the endomysin wrapping each individual muscle fiber. So what I personally do to release the fascia system, I use the A1 to release the superficial fascia layer, the apparatic fascia layer, and I use the A5 to release the epimysin, premiysin, and endomysin. That's why I said it's impossible for massage and foam roller to release the fascia layer, because you cannot go deep enough to exert mechanical force. So it's very important to go deep to the fascia layer to release it. So to sum it up, what should you do to stop or relieve hand pain? First thing, you need to avoid the repetitive motion that aggravate your symptoms. If you do a lot of hand work, I will take a time off. Usually with mild inflammation, that should take a day or 2 or a week max, and the inflammation goes down and your body start to heal. But if you have a chronic condition that your body going back and forth between inflammation and proliferation stage, you have to be aggressive on breaking that vicious cycle by decreasing the inflammation and breaking the proliferation stage by releasing the fascia restriction, the muscle spasm, the trigger point, and the scar tissue. And that's conclude our video on how to stop hand pain. If you have any question or comment, leave it in the comment section below and I will answer it in the future video. We'll see you soon. Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below or go to astrinstitute.com.